All right. Good afternoon or morning, everybody. This is Brandon Garrett once again. I don't know if you can see me or not, but I'm actually, appropriate enough, I'm at my doctor's office. But looking forward to the discussion with, as always, Mia Keeys and Ted James, who's state rep out of Louisiana, a good friend of mine who I've known since early 2000s, I guess. But want to go ahead and share his story and what he's doing on COVID. So without further ado, I'm going to pass him on to Mia.
Thank you so much, Brandon. And we want to make sure that you are doing all that you can to remain well. So we won't keep you too long so that you can be attentive in your doctor's appointment. I'm always, wanting to encourage our men, especially our Black men, to practice wellness from the inside out, all around. So very good posture here with your mask and just overall practice of wellness. Thank you, Representative Ted James, for joining us today. We are really going to have a complete conversation, if I can use that terminology. And for any of you who have watched Representative James in action on the House floor, you know that complete conversations are certainly his MO. So welcome to you, sir. I don't want to take up too much time giving you your very extensive bio, because I think what you have to tell us is something that we really need to hear. But I will say that you're a state rep from the state of Louisiana. You're quite passionate about your home state, and particularly the Baton Rouge community. So we're really excited about you bringing that perspective. And as a lawyer yourself who has had extensive work across the state and in different venues, including the governor's office, and being an advisor in that sense, and being present during the rebuilding of not just Hurricane Katrina, but also Hurricane Rita, and then also just being in as your tenure as a staff attorney, and then eventually a Louisiana State Rep. We just want to hear everything that you have to share with us, especially as it pertains to your recent bout with COVID-19 against your life. And so without further ado, I welcome Representative Edward Ted James.
Thank you, Mia, and thank you, Brandon. And I'll too give you a shout out for being in the doctor's office. Too often, Black men, we don't go until there's a problem. So I'm hoping that you're there just for a checkup and making sure that you are keeping yourself healthy. And Mia, thank you for that wonderful introduction. And let's just get right into it. Ready to talk and talk about, my journey with COVID, amongst other things going on here in Louisiana.
Sure. And so I just want to remind our audience, for any questions that you might have that you want to elevate during this conversation, please feel free to do so. Please drop your questions in the question and answer box, and keep keep chatting if you want in the chat box. So we want your questions in the question and answer. So Representative James, let's just level set with us here. How are you doing right now?
Yeah, I'm doing well. Ironically, I'm just getting back from running around the same lake that I ran around the day before my symptoms started. So back out exercising. I'm not going back in the gym, but I have been doing some in-home exercising and going out to jog. So I'm feeling good. 100%.
Let's actually visit that, because today's conversation is essentially about life after COVID, right? Mm-hmm. Now, when we have the conversation nationally, a lot of the conflated conversation around COVID-19 is that people who have pre-existing conditions are more likely to be susceptible to not just COVID-19, but really any virus, right? Mm-hmm. But you just alluded to running and to extensive exercise. Can you tell us a little bit about your overall health practices? Because I want to put that out there.
Yeah, I don't always eat as I should, but regular exercise at least 4 to 5 times a week. I used to do a lot of Orange Theory, like before COVID, and I would do jogging around the lakes and a couple days in the gym. So very active. I was asthmatic as a kid. I haven't had really bad issues with asthma post high school. I had really bad allergies And earlier this year in February, I actually had sinus surgery because my sinuses were just so bad, and I had a deviated septum. So outside of just allergies and sinus, relatively healthy. And like you alluded to, Mia, when we heard everything about COVID, I was in the population that, of course, I was going to practice the social distancing and that good hygiene, but I didn't find myself concerned. I was more concerned for my parents, my dad who is diabetic, my mom who has had health challenges. So I was more concerned about their well-being than, not thinking that I would end up in the hospital.
So then what gave you pause? What alerted you to the fact that you might be COVID positive, especially given all of your activity? Yeah,
so we had just started legislative session. So the session started in Louisiana on March 9th. So Monday, March 9th. And then by Thursday, we adjourned for the weekend, not knowing, we still hadn't had one reported case in the state. So that Thursday after we adjourned, the NBA is suspended. So that's when things started to get real, right? So on that Friday, we had the first reported case in Orleans Parish. So we phone calls throughout the weekend, not knowing, but we knew we had to go back to the Capitol on Monday. So we go back on the 16th and suspended the session. And the governor enacted, like that at midnight, he enacted the stay-at-home order. So we're there not knowing, like it's very uncertain, but again, more concerned about the elderly population. And we saw growing numbers in New Orleans, which had just hosted Mardi Gras. So hundreds of thousands of people ascending to New Orleans from all over, like right on top of each other, drinking and crawfish balls and just a family affair, right, from folks all across the country. So during that week, we saw the numbers in Orleans and Jefferson Parish continue to rise. So I have a colleague in the legislature who we had all gone, and this is probably not smart of us to do. So that Monday when we suspended session, we all went out to eat before. We were like, we're going to get one last meal before things shut down. And one of my colleagues started experiencing some issues the next day. So he just thought that it was either he probably drank too much or something that he ate. Because he had like diarrhea. And we're going to be real, right?
This is a candid conversation. Absolutely.
Candid conversation. And of course, none of us were concerned about him having COVID. He ended up in the hospital that weekend. So this is Tuesday. He's not feeling well Tuesday when he's in the hospital that weekend. And he was tested. So at that point, all of us were kind of freaking out. But his test, they end up coming back negative. He was really dehydrated. So at that point, I started to really get concerned because I had been around him. And so this is like the 19th. So that weekend, I'm divorced and I have 50-50 custody of my little girl. So this weekend, Harper was with her mom, but I would go over Saturday and Sunday, spend a couple hours with her. So I go work out, spend a couple hours with Harper. We take a walk. I come home and late Sunday, early Monday morning, I go through 2 T-shirts, right, overnight because I'm sweating. I wake up Monday morning, the 23rd, and I have a fever of almost like 102.9. So I'm extremely worried at this point. And of course I'm calling and folks are like, well, you need a doctor's order to get a test. And, for me, my doctor wasn't responding. I couldn't get her on the phone. And luckily had it just been Ted James, I probably wouldn't have received the test. But Representative James, I called the hospital and I called the hospital CEO and I'm like, I need a test now. So I was tested on that Monday for both the flu and COVID. And then there was, rapid tests weren't available. So I immediately quarantined at home. And I just have a fever for a couple of days, just Tylenol around the clock, Gatorade, fruit, didn't really have an appetite, but no other symptoms outside of the fever. Get my results on that Thursday. And that's when I really started to worry about Harper because I had been around her. The lady that keeps Harper is ill. She's in her 70s. So I was worried about her because she had been in my house the week prior. And of course, I was worried about Harper's mom. But I'm still feeling relatively fine. Everything is starting to, really hit the fan about this virus. So I was like, man, folks knew that we had gone out to eat. Did I get it? Was it at the restaurant? Have that I went through, honestly. And then again, Saturday, I think I spent Saturday watching D Nice because I think he had started doing everything. And then so Sunday morning, my former legislative assistant brought some groceries and lunch. And I couldn't, like, my couch is right behind me and you see the door. I couldn't walk from the couch to the door to get the food. And I knew, and it's like something was changing. I couldn't really breathe. And her husband is a cardiologist, so she was like, "Ted, go to the hospital." And I couldn't, like, I can't drive to the hospital, and I didn't want anybody else to come pick me up. So I said, I'll just chill out for a little bit, see if I feel better. An hour later, the food is still outside. So I somehow go outside, bring the food inside, and then I drove myself to the hospital. So
now, how far away is the hospital from you?
Like 6 minutes, not far. So I go, and of course, like I said, her husband is a cardiologist, so he called. They knew I was on the way, and I get there, and this hospital is one of the largest hospitals in Baton Rouge. So you pull up to the ER, and I mean, usually the ER, hundreds of people. There are people checking folks in. There's a security guard outside. There are literally 2 people outside. Tent and 2 people, full, like, mask, full, just PPP, like fully, just like you see on TV. So I pull up, they tell me to park, they bring a wheelchair, and immediately I'm just, as I go in the hospital that I've been in several times, there's nobody in the hospital. To the hospital, and they put me in a room, IV, EKG. Within an hour, I'm told that not only I knew I was already COVID positive, but they also chest X-ray. They told me that I had pneumonia. So at this point, I'm crying and crying. I haven't called my parents. My parents think that I'm still at home. So I end up FaceTiming my mom, and I'm like, I'm in the hospital. And she just, like, my parents just completely broke down. And of course, they can't come to visit. So just the fear started to sit in for me. And I'm thinking about Harper. I'm thinking about, all of the folks that I had been in contact with, trying to call people to say, hey, like, I know I told you that I was positive, but now I'm in the hospital. So they admit me on that Sunday, and like maybe Sunday, Monday, Tuesday, a complete blur to me. Just way too much fear, not enough praying. And I'm concerned about Harper. I'm calling my friend who's a lawyer, trying to update my will. I'm like, I need you to get it up here so my business is in order. Because I really, I thought that I probably would never see my little girl again. And that's how, just how bad I was feeling. EKG, IV, not being able to breathe. And I tell people, it's almost like you go and you sprint, you run a 100-meter dash, and you're trying to catch your breath. That's how I felt for 3 days in the hospital. And, I tell everybody about one of the nurses that I had, Lance, who is my former legislative aide husband. He's a cardiologist. So he comes to see me one morning, and then he calls his wife, Kim, and he's like, you need to pray for Ted because he's out of it. Like, he's checked out. Like, at this point, he hasn't eaten anything. He's not doing his breathing exercises. I had this thing, they gave it to me. The first couple of days, I didn't even take the plastic off of it. And I'm just feeling sorry for myself. very scared about, you know, again, my daughter is running in my mind. And, you know, I would FaceTime her, but, you know, she could see the, you know, tubes in my nose and just, you know, Daddy, are you in the hospital? Are you sick? And she, you know, she's very smart. But so it wasn't until like maybe that Tuesday night, late Tuesday night, I had to go to the bathroom, and I'm calling a nurse, and it takes, it's not like a regular hospital visit where you hit that button and a nurse pops up, because they have to go and get fully outfitted. They can't just come in your room. So he has to get dressed, and I'm hitting the button, and they're like, Mr. James, we're coming. He's trying to get there. Please be patient. And so I couldn't walk. So the guy, he's like, look, either I'm gonna come in there with you, or I had to take you off this oxygen for you to go to the bathroom. And I'm like, dude, you're not coming to the bathroom with me. Like, you know, I'm gonna do this on my own. And so this is so late Tuesday or early morning Wednesday, it's like maybe 1 o'clock in the morning. So this is the first time that I've been off of oxygen to go to the bathroom. And he's like, look, I'm gonna stand right here by the door. If you feel like trouble is starting, just start knocking on the wall and I'm coming in. So I go in, I use the bathroom. I'm in there maybe 4 or 5 minutes. And so I get out, and he's like, man, it's been 5 minutes and you haven't had oxygen. So you have been laying here for 3 days. This virus is not something that you are going to sleep off. You have to actively fight this virus off. So what he did, he holds my arm and we walk back and forth in my room before he puts me back on the oxygen, and he goes to give me some apple juice. And, you know, at this point, he's been in my room maybe 20, 25 minutes. And this is the longest that anybody had been in my room, because they're in and out. A lot of them, of course, you know, they're frontline, they're fearful, they have to go back home to their families. So they're in and out. And this guy is like 25 minutes making sure that I'm actively trying to fight off the virus. Because, like I said, for 3 days, I'm laying there doing, you know, in more fear, not enough praying. And, you know, at that moment was when he he started asking me about my family, he asked me about my daughter, and he's like, man, you got to get out of here to see her again. And in that moment was when I really started to, you know, try to go through the breathing exercise. Like with this thing, I couldn't, you see, it's like 500, I couldn't even get it to the first line, right? So I'm breathing and I couldn't even get it here. But at that point is when I really started to try to fight back.
Wow. So thank you really for walking us through that, you know, to even talk about it, to even relive it, just feels vivid, right? Like I felt it in my chest when you were talking. I'm a sprinter, so I know what you mean when you say at that end of that yard dash, what that feels like. Mm-hmm. It's a seizing of the chest, right? But to experience that for days at a time, of course, that would be draining. You know, so you brought up some really very critical points that I want to pick up in the non-medical space, and then I want to get back to the medical space. You talked about fear. You talked about getting your business in order, right? You talked about not praying enough, and so that alludes to your faith, and choosing fear over faith at some points. And also you talked about isolation. Yeah. And your mental state at the time. So not just were you fighting against the virus, you also had to fight to come into a space of wellness for yourself and wanting to be present. And the role of that nurse who was with you, he had to have played a critical role beyond even just the care. So before we move on to the next topic, I'm wondering if you can touch on any of those a little deeper.
So the isolation is probably the hardest part for anybody that's going through, that's battling COVID. For me, I am one that I'm a people person. So just me being in this house by myself was trying enough before any symptoms. So and I'm watching television. I'm reading every article about COVID, and so the isolation was really getting to me. And my pastor, so after the word got out that I was just sitting there not really fighting, of course he's calling and he starts talking about mind over matter, Like he's like, I'm not even gonna pray with you right now. He's like, just mind over matter. He kept talking about it. And he's like, you know, that fighter that I see in the community, that's the fighter that I need to see in the hospital. So then he starts to talk about praying. He was like, you need to start thinking about what is the lesson, right? Because he constantly talks about life versus school. Like school, you get lesson after lesson to prepare for a test. Life is the opposite. So he's like, he picked you for a reason. So pray, and you should be thinking about Harper, and you should be trying to determine what is the lesson that he has for you, because you're in that hospital bed for a reason. And that was one thing that I had to check myself, because it's probably one of those, oh, this is not gonna happen to me, right? And then I'm like, he chose me for a reason, right? And then the nurse piece is that, like we talked about, us men, black men, not wanting to go to the doctor. So for me, I was willing to take the oxygen off because I didn't want that man with me in the bathroom, right? And in my mind, had it been a female nurse, it probably would have been a different story, right? I don't know. So in that mind, in that conversation with my pastor, he's like, get your ego out of it. Like you are nobody special. Like you have all these titles, but you are a man that God chose to put through this. And the other piece, I alerted some people, but my dad, as soon as I was positive, he was like, you need to make a statement. And so at that point, it's like, I said, I give up a lot of my personal being as an elected official, but this is my health. So I don't want to make this a thing, right? But when I'm in the hospital, one of the reporters, he kept calling me. The Monday I'm in the hospital, he kept calling me, and I wouldn't answer the phone. And so he texts me, he's like, Ted, man, this is the hard part of my job, but you know, I heard you in the hospital. At this point, it's been confirmed that you're in the hospital. And I have to write a story. And I at least want you to give some input. I at least want you to, you know, put a statement out. So, you know, I type up something and I sent it to him. So at this point is the whole state knows that I'm in the hospital with COVID. And again, this is like 2 weeks after we shut down the state. So it's very new. And at that point, it became real to so many people. And I realized, like, maybe God is using me to show people how serious this is, because we were told that if you're young and relatively healthy, you don't have to worry. So maybe he chose me to get folks to really take it seriously. And I hear that even now, like people tell me, like, you made it real for us. So just that piece was really challenging, because I wanted to kind of keep it a family discussion. But when it came out, it was almost like I started to think about, like, my role as a public servant, my role as a father, and how, like, there was no way to separate the two, and how I had a responsibility to really get out there and show people, like, this thing is real. Because before me, like, Sean Payton, the Saints coach, was probably the first, like, big figure in Louisiana to test positive. And then it's me, and I'm positive and in the hospital. So just all of that, like, in that isolation, gives you nothing but time to think. And for me, it was accepting that I was chosen for a reason, and it wasn't to sit there and let the coronavirus take me away from my child.
Yeah, thank you for sharing that, and sharing your wisdom and sharing the wisdom of others who spoke life into you. You know, I can grab onto to so many points of what you mentioned. I want to talk a little bit about the mind over matter piece, right? Because what you're talking about there is will, right? And there's a philosopher who I read pretty consistently. He's the two of you share a name. His name is James Allen, and he wrote a book called Mind. I think it's called Mind Over Matter. But anyhow, in the beginning of the book, it says, "Mind is the master that molds and makes, and man is mind, and evermore he takes the tools of thought, and willing what he wills, wishing what he wills brings forth 1,000 joys and 1,000 ills. He thinks in secret and it comes to pass. Environment is but his looking glass, right? And I really take that to heart in terms of putting, to your point, putting myself in situations and encouraging my loved ones and using my life as a platform to encourage others as well, to will yourself through situations that you've been called to push through, so that you are able to use your life as a testament in whatever realm, professionally, personally, for other people, to help them reach a certain level of clarity and impact. But when you're talking about willing yourself through a disease and fighting, right, it really takes a system to be behind you, right? It takes a cadre of professionals who are on your side, of family who are supportive, and there are others who have not been in your position to have family and loved ones, to have physicians and healthcare system rally around you, right? And we even see this not just in health, we see this in politics and policy as well, when you're talking about political will, a different level of will, right? So I want to segue a little bit into that space. When we're talking about these systems that are not always designed to advantage those who, or even particularly care for those who over a long period of time have not been able to will themselves into spaces of wellness, right? So let's talk about that a little bit. And actually, before you answer that, I do want to just ask the audience, and this is a poll question, you can answer it with multiple answers. Have you ever known anyone who has had COVID-19? Or have you yourself had COVID-19? And you can go ahead and answer that. And then I want to get to your question about will in the political space, please, Representative James.
Yeah. So I think that, this virus and what has happened across our country exposes so many issues in both the health and political spheres, right? It's when you see the alarming rate of deaths in the African-American community, you can't ignore the gaps in just healthcare in general in communities that are Black or low-income communities. Just the lack of FQHCs in certain area, right? The fact that the reimbursement rates in Medicaid are so low that a lot of specialists don't accept Medicaid patients, and folks on the other side say, "Oh well, y'all have to stop using the emergency room as primary care," but aren't cognizant of the holes that exist and the gaps in some areas. That's all that they have, right? If you're a Medicaid recipient in rural Louisiana, you're not going to be able to go and get specialized care, right? Not in your parish. You might have to travel a couple parishes over. And then just in the political space, we know the other piece is that the essential workers, a large percentage of those essential workers look like us. So they couldn't stop working, right? So who's going to provide for that child, right? Who's going to provide for that family? Or if you were caring for your elderly grandmother, your elderly aunt, all these gaps that exist in, adult care, right? We've seen higher rates of infection in nursing homes here. Adult care facilities that are full of folks in our community. And while I was at home recovering, it's ironic, my colleagues were rushing to get back to the session. And not only was I hospitalized, but I had a colleague to die. And they were rushing to get back to address the economic impact for a big business, not for the workers, not for the healthcare industry, but they wanted to go back and use this as an excuse to really advance tort reform that folks have been trying in Louisiana for years, and rushing to get back while we were still under a stay-at-home order. We had not gone into phase one. So as legislators, you want us to go back while we're telling communities, restaurants not to open, but we're going to go and sit and advance issues that have absolutely nothing to do with addressing the gaps in healthcare, addressing issues of unemployment that we saw rampant in our community, because Louisiana, we are a tourist place. Like New Orleans, you know, a lot of people make their money in the hotel industry, in the music industry, giving tours to all of these folks that come to Louisiana and want to see the bayou and want to go to these different places. It's a whole industry that's shut down, and it exposes a lot of gaps. And then we question why folks don't want to get involved in the political process. And you see that when we have issues in our community, any type of tragedy here in Louisiana, it could be a hurricane. With COVID, it further widens the gaps that already exist. And it just, and it's funny, people don't, you know, always want to talk about the political implications of this pandemic, but they are real. And you can't have one conversation without the other. And when we talk about just these, you know, breaking into spaces, these last few months should be the indicator that folks need to really get involved in the political process, right? Because it's a clear indication of like, we're going to be for the people, right? Or we're going to be for the businesses. And there's a way to do both, but we haven't gotten there yet, because all you see is two different tracks. And it just, you know, further pulls people away and not wanting them to get involved.
Yeah, again, just really very salient points that you're making. I want to see what the audience has to say in terms of where they've been. Have you known anyone? The majority of people, almost 70%, are saying they know someone who has had COVID. And some of them are saying they either know that they have or have had COVID, almost 10%. So thank you, audience members, for answering. And I think someone also made a salient point in terms of chronic disease management and what it feels like to potentially be an essential worker who deals with chronic conditions and being overly exposed in that way, right? So much to pick at. I want to stick with the political realm and political will here, right? Because not only are you a survivor of COVID-19, but you are a man who is African American, right? And you live in the U.S. South. And you are a state legislator. So can you talk to us, Representative James, about this syndemic of a public health crisis? So on the one hand, we've got COVID-19, this pandemic that's impacting everyone around the world. And then on the other hand, we have this pandemic of violence. And violence can be expressed in so many ways. It can be expressed in terms of inaccessibility to, or shortages with respect to healthcare. It could be with respect to police brutality. Or food insecurity. Violence can express itself in so many ways. Talk to us about this complex public health, what it means for you to know what it feels like to fight personally and professionally against this syndemic of violence against Black and brown bodies and the pandemic.
You know, I'll tell you that if in the state of Louisiana, if we saw the number of deaths in the white community that we saw in the Black community, there's no way that my colleagues would have been trying to rush back to the state capitol, right? If this virus had attacked areas in North Louisiana and Central Louisiana, there's no way that my colleagues would have been urging the governor to open the community back up. And that is a source of violence, because you are forcing people into situations where their health is being exposed. You are putting people in situations where they can contract or spread COVID-19 to other folks, elderly, especially in communities of color. And then when you talk about the issues of policing, and for me, a Black man that walks into a state capitol with, you know, we Confederate monuments inside the building, right? And pictures, the illustrations of our ancestors picking cotton in the building, right? Etched on the walls. And then in the middle of all of this, you see civil unrest, not really unrest, you see civil demonstrations, because the unrest happened, but that wasn't us. right? You see these demonstrations in a response to violence against our community. So when you have a virus that's already attacking us at alarming rates, and then you add to what happened with Brother George Floyd, you add what happens with Breonna Taylor, and it is like an all-out assault on people of color, right? And the issue was so dire that even in a community drastically impacted by this virus, we still took to the streets to voice our concerns around issues of violence against Black and brown bodies. And while some folks want to, put it in a vein as if, we obviously didn't care about COVID because we were out there protesting, that's just how serious the issue is, that we are willing to go out there in the midst of a pandemic to make sure that our voices are heard and demand action. And, for me, I actually contemplated resigning from the legislature. Like when I first got home, I'm like, I almost lost my life. So I don't know if this lesson is for me to go back into this building to go serve in this body with folks that, really don't really care about the well-being of, not just me, the guy that died, my colleague Reggie Bagala that died. And then George Floyd happens, and I'm reminded, like, no, this is the time you got to go back, right? This is the time when your voice is that much more needed and is going to be elevated in this critical time of continuing to break down those barriers, especially those political barriers.
Thank you for that, Representative James. So we're going to get into some of the questions that the audience is bringing up in just a couple minutes, but I want to stick with how you're handling yourself in the legislative environment. Tell us a little bit about some of the causes that you've picked up. What mantles are you carrying?
I am real big on criminal justice issues, expungements. I'm real big on unlocking those barriers to prosperity. In Louisiana, we have such a convoluted system of expungement. So I've tackled that issue, restoring voting rights for felons, trying to get felons to, serve on juries. A lot of my work is there. Police reform. We have a system of, police unions that have way too much power here. I've filed, a lot of them haven't passed, but, we passed some chipping away at the police unions here. Speaking of health, I'm real big on medical marijuana. I filed the bill to really bring the program to life here. We made a decision that we have, I'm a graduate of Southern University, and we have an ag center. So we made, I amended earlier versions of the bill to require that we would only have two growers in the state, and that's Southern University's Ag Center and LSU's Ag Center, because, revenue, of course, was important. But for me, I see it as a selling spot for my HBCU, right? We are one of two colleges in the country growing marijuana, right? And that in and of itself interests people, right? And the fact that so many people in Louisiana, we always last to do everything in Louisiana, right? So many people here rejected the science behind medical marijuana. And it was such a, it was so taboo years ago, and I think it was 2016, 2017, when I initially really, put some life into the program. So I've worked to expand our program to cover certain conditions. We fought to make sure that the pharmacies that will be able to dispense be able to make sure that those with recommendations can come in, make sure that African-American owned pharmacies were well situated to be able to participate. But I think the majority of my work is around criminal justice. I'm the chair of the Criminal Justice Committee. And the sad thing is I'm the first African-American chair of the Criminal Justice Committee in like the past 70, 80 years in the state. That's problematic, right? I'm so, tired of being the first. Like, in 2020, we shouldn't be the first doing anything at this point.
We should not, but here we are.
Yeah, yeah.
Tell us more about your criminal justice and police reform work. So, and speak to us, if you can, about the police training, screening, and de-escalation task force. And for people who are tuning in, our audience, Keiko has just linked to a speech that Representative James gave on the House floor. And you mentioned one of your colleagues who passed away. I think this speech was in response to a speech that he gave, correct?
Yeah, so we had, before George Floyd, we had Alton Sterling here in Baton Rouge in 2016. And we passed some bills in 2017, but 3 years later, we recognized that there are certain issues like qualified immunity, our unions that can, reverse decisions of police chiefs when they fire officers. So while we made some strides in 2017, of course, we realized that there's so much more work to do. So we immediately started to respond to the demands of protesters, not just in Louisiana, but across the country. And, I talk about Jordan Harris, he's a state rep in Philadelphia. And he is this guy is the leader in criminal justice reform. And he and I are really close, and we share ideas all the time. And I saw them because they are a full-time legislature. And for us, we were in session, but we were in a special session. And the special session had a very small call. So we couldn't legislate regarding certain issues. So people were worried about, why aren't you guys talking about police reform with everything going on across the country? And we had to explain, yes, we're in session, but we're in session, a special session that's only confined to these items. And these items were included in the call prior to us learning about George Floyd. But we filed a study resolution to create a task force. And even in that task force, just the mention of George Floyd, putting the statistics about how Black and brown bodies have gone from men, husbands, fathers, nieces, daughters, to hashtags. Some of my colleagues didn't even want to include that language in bills. So I had a bill to create a commission under my criminal justice committee. And in one of the committees, one of my colleagues, who's a white female, she told me this is the most racist document that I've ever seen, because it spoke to the loss of Black lives at the hands of white police officers. That's what my bill said. So we go through this whole debate in committee, and there are certain moments that, for me, there have been moments early on in my legislative career that I would have just fought her tooth and nail and just let the issue die on principle. But for me, this issue wasn't about me. And it was too important for me to allow them to not get to the subject matter over 3 or 4 sentences in a 5-page bill. So I agreed reluctantly, and then I could count. And I knew that if the language is in there, the bill was gonna die. So we tweaked the language to make them feel a little bit more comfortable supporting it, and in the hopes of getting to the, you guys in the preamble, the whereas. So I was less concerned with the whereas and more concerned with therefore be it resolved, right? So I wanted to get to the issue. So we amended the bill. And while I'm working, there was a Senate bill that creates the task force that gave birth to that speech that you guys have seen. So I decided to go with the Senate bill because it was a better bill, right? It was a better version of the bill, because what I wanted to do was to create something just small in the House, but the Senate version would have been a statewide task force that would have brought in other people. So during that, similar conversations, we mentioned the study about how the number of Black and brown bodies that have died at hands of law enforcement. And my colleagues, I'm in the legislature, it's 105 of us in the House. 68 of them are Republican, right? You need 53 votes to pass things. So they started making a stink about the mention of George Floyd. Why are we mentioning George Floyd? This didn't happen in Louisiana. So I said, well, let's just say several, because George Floyd, we could add, and if you hear the speech, we could have used 6 pages of names. Like we could have started with Emmett Till and gone all the way down to George Floyd if we wanted to just, so I said, well, let's take George Floyd out and let's just say several, because it's more than just him. So anyway, we have all these discussions like in the office with the speaker, because over the past, I think the prior 2 weeks, we had so many racially charged incidents that almost went to blows, right? So there was a conversation about, let's just get this resolution passed and get to the work and not recreate a lot of moments that we had already gone through. Because in the midst of that, we had LSU's library. We changed the name of the library. Middleton was a Confederate general, so we took the name out. So we had other colleagues my white colleagues started to file resolutions to highlight all of these Confederate generals, right? So then some of the Black Caucus members started to file legislation about Black Lives Matter. So it was an all-out, like it was beef, right, in the Capitol. So the speaker is like, hey, man, like, we've had all of these different things. Like, let's end on a good note, on a more unifying note. And I was like, okay, let's do it, right? I've said my piece. Let's get to actually doing the work. So we tweaked the language again, and I get to the floor, and while we're debating the bill, one of my colleagues, he comes down and he wants to talk about, well, I read a study that talks about the number of police officers that die in the line of duty. And if we're going to have a conversation about policing, we need to talk about all these police officers that risk their lives and die every single day. And if you, prior to the video that folks have seen, you'll see me in the background. I was just sitting there at first, and then I jump up and I get a sheet of paper and I just start writing. Because at this point, I'm actually happy that he did it. So I'm like, the gloves are off at this point. So I'm writing my little notes, and my niece works at the dais. So she was like, you about to say something? I was like, yeah, I'm just, at this point, we here, like I said in the video, like we here now, like I ain't gonna start it, but I ain't gonna run from it. And so it forced me to have that conversation that, of course, folks are like, oh, this is so uncomfortable. And I started to think about back to COVID. I'm like, God did not send you back here to like allow folks to mute your voice, right? And at some point, at that point, I was willing to risk the whole resolution to have the discussion. And that is how, that video came to be, with me going and giving this history lesson about, the real issue, and the fact that police officers that murder Black and brown people, they end up getting taxpayer-funded vacations. They don't get arrested, and spoke about an issue that I've had as a member of the legislature, where police officers pull up to my barbershop and demanded to see IDs. We're standing out, just having a conversation. They jump out of the car, demanding to see IDs, and I told everybody, I was like, stop, I'll give him mine. And I gave him my legislative ID, which is it's almost like a sheriff's commission. So it's a badge. So I gave him that, and then I gave him a card to my law office. And one of them was like, oh man, I'm sorry, I thought you were one of them. And I blow up, and I'm like, dude, I am one of them, right? Like, this title, this badge doesn't make me different. I have a different title, but I am one of them. And that, even in that moment, it's funny because some of my colleagues actually had the audacity to come up to me afterwards and say, did something really, you could tell me the truth. Did something happen? Did they really just show up there? And it is like, dude, are you even listening? Like, do you realize how biased, how racist, how bigoted you are? Like, the one thing out of everything I said in those 6 minutes, that's the one thing that you want to know. Like, did something really happen? Like, they're so quick to give police officers the benefit of the doubt on everything, right? And so that's kind of where we left off in that session. And now we are, actually last week we had the first meeting of the task force. So now we are, getting down to the nuts and bolts.
Well, clearly there's still a lot of work to be done, and you're carrying the mantle. We want to know about. I wish we had even more time to just unpack a lot of what you said, because I don't want to give the impression I'm trying to breeze past it. I'm still receiving, and I think a lot of the people in the audience are still receiving what you're saying. I want to talk though about, now that you are back, how do you feel? Are there parts of yourself that are that feel differently? Are there side effects from COVID? Are there resolutions that you've made with yourself about how you'll in terms of your legacy as a state rep?
Yeah, so I physically I'm almost 100%. I measure like distance. So pre-COVID, my time running around this lake was a lot better, right? And for me, my diet has changed. In the hospital, I lost not just in the hospital, but the month that I was dealing with COVID, I lost 23 pounds. I found 8 of them since COVID. So I have lost a significant amount of weight, but I can still feel like my energy isn't always there. And as we talk a lot about hydroxychloroquine, like I was given that in the hospital. So in my mind, I tried not to think about what it could have done to my body, right? You hear about blood clots. You hear about people that, have gone through COVID, they go home and then they're having issues with clotting. I've, gone back every 3 weeks to make sure that that's not an issue for me. But I do worry about what that medication is going to do to me long term. And I have friends that are doctors and they're telling, look, it's been around forever. It's probably not, should have been used for COVID, but we don't think that there are long-term effects. But one thing that I keep reminding people, Mia, early on, it was the novel coronavirus. Like we have forgot about the novel piece. And with it being new, right? When I got sick, I was told, hey, you don't go get a test unless you have symptoms. We know that that's not true because folks are saying, go get tested, go get tested, go get tested. So, and I don't know if that was a political decision because we didn't have the availability of test kits, or we just didn't know. So I will tell you that I don't sit here with the belief, although I got tested for antibodies, I gave plasma. I don't sit here with the belief that I can't get COVID-19 again. Like I don't. And because people forget that the novel piece, like this is new. We don't know. So there's still a level of, not just fear, but I do think about it often, right? I think about what this medication could be doing or could have done to my body long term. And, as we move back into, different phases, I do worry about one day ending up in the same position.
Tell us about how you consider your family in all of this.
Well, we, my parents, of course, thank God that they haven't been impacted. I try to not, like my daughter's birthday was last week. We tried to, of course, I wanted to do something special for her. But everybody, you can't come over here, right? You can't do it. And for my daughter who's 3, she didn't have any symptoms, but while I was in the hospital, her and her mom got tested. So and she was positive. So for those of you out there that believe that young people can't get it, no, my daughter was 2 and she tested positive. Thank God she didn't have symptoms. But my daughter was positive for COVID. So I worry about her as well. The decision, she was supposed to start school on yesterday. She's supposed to start pre-K. We haven't decided to bring her to school yet. And for my family, as both of my parents work, I worry about them constantly.
Well, there's someone in the chat who is just telling you as a nurse practitioner to stay motivated, really pace yourself and know that you, in her words, you're in a great position to lead by example through your fight. Fear is real, but faith is victorious. I think that's quite a word. And speaking of a word, Representative James, can you leave us with any final words what would you have to say to us?
You know, I would just remind us of our shared responsibility. We know how this virus has impacted our community. So on that front, we owe it to our families to continue to, you know, not ignore the science, keep our families safe. Our shared responsibility, the fight for social justice is not, you don't need a title to be in this fight. And I remind you guys to everybody can play their part. I mean, the most important thing facing us right now is the census. So I would just encourage you guys, if you haven't completed the census, please do so. Get out there in your spheres of influence and encourage people to, you know, take advantage of the census. There's so much at stake dollars wise. When I look at Louisiana, I know that we have a lot of needs, but the money doesn't follow the need, it follows the count. So it's important that we're out there and we're counted, so that resources can trickle down to our communities. And then on next year, when it's time for legislatures across the country to redraw lines, you know, if we're not counted, we're going to be permanently locked out of political power, and that we're not going to be able to include ourselves in legislative districts across the country. So get out there and talk about the census for the next, you know, few weeks, because the administration did cut it down for, you know, 30 days. They took 30 days off of the census. So we're literally on the clock.
Thank you so much, Representative James. Really quickly, before I give final salutations, there was a quick question in the chat. I'm just going to address this very quickly. We have another, about college football. So we had another, Representative James didn't share that he's a member of Kappa Alpha Psi Fraternity Incorporated. We had another Kappa on the show, and also a state legislator, maybe about 2 months ago, if I'm not mistaken. Keiko can double check. But we had a session on playtime after COVID. And so we had Aeneas Williams, who was previously an NFL player.
Southern University, Alpha Sigma.
Southern University.
That's right.
That's it. So that good Kappa brother came through. Eric, I encourage you to take a look at that video if you want to learn more about some of the things that some of our panelists have had to say about football. But we are at time, and I am a fan of hard stops. But did you have anything about football that you wanted to share?
You know, I think my child wouldn't be playing. But it is, you know, ironically, we announced $1 million small business micro grant program Rouge yesterday for businesses impacted by COVID. And every single question from the media was about LSU football. And it's just, I mean, it's a $50 million economic input to the city of Baton Rouge. So I know that we need the revenue, but, you know, it's not worth continuing to lose lives. So, you know, I think that, you know, we got to be real careful. And I wouldn't want to see it until the numbers are drastically reduced here. We're still in phase 2. If we're not in phase 3, we certainly don't need to be playing.
Ditto, Representative James. Thank you. This has been really great. I hope that you'll join us again in further iterations. I'm still taking in all that you said. So thank you again. As always, I'm Mia Keeys with the American Medical Association Center for Health Equity. Thank you to the National Minority Equality Forum for continuously bringing these conversations to everyone. And with that, I turn it back over to Brandon Garrett.
Thanks so much, both of you. I really do appreciate it. And I'm back. I was nothing too serious, but I just had an injury that I had to take care of. I dropped something on my foot.
Oh man!
And had, you know, one of those last kind of rush to the hospital. And that's at the time of COVID. It's like, well, you can't go to the ER. Like my ER doc friends, well, you don't go to the ER right now, and urgent care. And then there's like a 4-hour wait there. So it was like I had a friend that worked at the hospital, and it's like, come in now. This is pretty much the only time you can go. So hey, take my doctor and all my healthcare folks' advice. But I just want to echo what Mia said and really thank Ted. I've been wanting to get Ted to discuss just kind of all he's done. And so being from Louisiana, and I didn't have the opportunity to go to Southern. My mom did. I'm Dad's a Grambling guy, so I'm a Bayou Classic baby. I'm very proud and happy for my state that they have you there.
Thank you,
continue doing what you're doing and working for the people that have the most need. And hopefully, I know that you're not a political organization, but I know that you're up for head of the Democratic Party of Louisiana. So good luck in all your endeavors. And we look forward to having you work with us more here at NMQF.
Looking forward to it. Thank you, brother.
All right, everybody else have the will to do and get out the vote. Thanks.
Thank you, Mia.
Thank you so much. Talk to you all. Bye-bye.
Talk to you later. Bye.